vibrant city of Nairobi, where the rhythms of life intertwine, healthcare professionals and visionaries gather at the Medic East Africa Conference.
There's no other event that brings some of the biggest bellwether clients in the world, like Siemens, Mindray, United Imaging, but also we have international pavilions. So we have an international pavilion from Germany, from China, from Korea, from India, from Pakistan, something that other events aren't really showcasing at the moment.
This transformative event promises to not only shape the future of healthcare in the region, but also illuminate the human spirit. Our journey begins with Bionic Technologies, a trailblazing startup with a mission as bold as their innovations.
My name is Muaaz Zahid, and we are from Pakistan, and I belong to Bionic company, and we are presenting Bionic arms. Actually, I lost my arm because of electrocution. I got electrocuted in 2020. After that, I was looking for the solutions in the entire world, but I found the solution within my country in Pakistan in the form of Bionics. So here you can see my stump. I lost my arm, and then I got the arm from the Bionics, and then after that, I getting my arm, I was able to do my daily tasks easily, like drinking water, like driving. As my background was from the music, I was playing guitar before the amputation, and now I'm able to play guitar even with this Bionic arm.
He lost a limb but discovered a second chance at life through a bionic limb. Watch as he strums a guitar, a testament to the harmony of human machine.
तुझसे ही तो मिली है राहत, तू ही तो मेरी है चाहत, तुझसे ही तो मिली है जिंदगी। तेरी यादें हैं कुछ अधूरी, सांस आधी है कुछ है पूरी, आँखों में है कैसी ये नमी। मेरा मन कहने लगा पास आके न तू दूर जा। It's about love. Vertical.
Stepping into the Bionics exhibit is like entering a realm where science meets artistry. Meet Qureshi, the visionary who dares to redefine prosthetics. His name is synonymous with affordability and style.
If you talk about the arm disability, that is something what keeps you away from day-to-day tasks, and you are dependent upon others. And the thing that I'll mention here is like 60% of the population of disabled community, 60% of the entire population lies in the developing countries. So Kenya, Pakistan, and they have the same issues. So we designed and developed these prosthetics, and we have made it affordable to be sustainable as well. So they are affordable, robust, and waterproof and sweat-proof prosthetics backed up by a mobile-based application. So that if we'll provide a prosthetic in Kenya and the prosthetic is having a bit of issues like the calibration issues or anything, so the beneficiary can connect his prosthetic with the mobile phone and we can calibrate it online. And the best part of this mobile phone integration is that it is backed up by an AI-based cloud monitoring system which provides a customized firmware to every single beneficiary. That means it keeps updating the formula and the firmware of that prosthetic, and it is actually adapting the person who is using the prosthetic. So the person actually thinks that I am actually adopting the prosthetic down the line 15 days, the time when he starts using the prosthetic, but eventually the prosthetic itself is intelligent enough that it starts to learn its owner and it customize itself in terms of the software, and it is very easy to be utilized.
Here, our 3D printed prosthetics are not just tools, but also expressions of individuality, each integrated with sensors and software for a seamless fusion of technology and humanity.
to know is that there is no surgery involved in it, and they certainly do not need to travel there as well. So the solution can be delivered at their doorstep, and without any hassle of travel. So there is no traveling cost, there is no visa cost, there is no accommodation cost involved, and besides that, there is not a single injection that they need to have. So most of the people are actually traumatized because they already have been through an accident and been through surgeries, so they are pretty scared of having a solution, because most of the prostheses internationally available, they require a pre-prosthetic surgery, but we do not believe in a pre-prosthetic surgery. So we have developed our solution that and good enough that they can get it without any surgery, any medical intervention. And the most important part is our prosthetics are backed up by sweat-proof sensors. So in a humid area like Kenya and the urban areas of the country, so people can use these prosthetics, may work in the fields, use the tractors. Most of our beneficiaries are living in Pakistan, and they are doing their hard jobs and doing road day-to-day tasks, because the arm is made from carbon fiber and aircraft aluminum, so it is very robust and sturdy.
Venturing further into the realm of innovation, we discovered the Sseruyange device, a revolutionary tool that transcends mere medical utility. It is transforming the age-old practice of circumcision, making it safer, efficient, and less intrusive. With delicate precision, the Sseruyange Medical Device Regulatory Manager reveals how this ingenious device is changing lives, one procedure at a time.
It's done by professionals. We train nurses, we train CEOs, that's clinical officers, medical officers. They can be done in the hospital. Because if you leave something like this to go home and practice by yourself, you cannot manage to do it. It needs a service of two people who are going to hold it side and side, and you place the inner ring, the outer ring to do hemostasis, and then they cut the foreskin, then you are set free to go home. So you are done, and it's placed without a cut, and you put on your pants. If you are a working person, you go back to the office. Not even your colleague will know that you've done circumcision. Not even your wife. You can decide even to surprise your wife that you did circumcision without even knowledge. That you can go do it, go back to the office, get back home, and pretend to be busy the entire time. You go back to bed late. After 7 days, it falls off by its own. So 7 to 10 days, it falls off. It doesn't need that you should go back to the hospital maybe to remove it. So even your wife will be surprised, when did you do this act? So that's it actually. We have the cream which is used together with us, prelocaine and lidocaine combination. You apply it topically and the place becomes numb. So when you are inserting the inner ring and the outer ring, there is no pain completely, and you can just do this exercise. So children will not be injected as injected, or they have the pain crying the entire night. So the suturing, and when you're going to remove the suture, is so painful. Even the cosmetic outcome of this procedure is so powerful. So even the mothers their mothers experience a lot the pain of the children, how the children go through this pain during circumcision. It will never be the same. So it's easier that we are moving away from the knives back to the rings.
Dr. Simon Kigondu, president of the Kenya Medical Association, a leading voice in East African healthcare, shares his insights on the significance of this event.
The government is taking a third stab on attempting to get universal health coverage for all Kenyans. And we know that the pillars of healthcare include health governance and human resources for health, ICT, and other commodity supply and service delivery. This conference and summit helps us define some of those things. We have exhibitors from countries around the world. A lot of the countries who produce quality laboratory and quality medical equipment here on display. This is a place where both public and private healthcare providers can get good deals on quality equipment. We have had discussions on how healthcare should be provided at a primary healthcare space, and how it can be provided also in the tertiary treatment areas. And we think that the summit will be beneficial to the debate on universal healthcare that the country is currently in.
Now, let's explore the intersection of technology and healthcare supply.
The idea and the concept of Medica Bazaar is to make healthcare accessible everywhere, and especially in remote areas. So we have built different verticals to basically improve the efficiency and the cost of procurement for healthcare providers.
Jean-Baptiste Michael, the driving force behind Medica Bazaar, shares his vision of breaking geographical barriers and making medical supplies accessible to all.
The gaps that were identified from the beginning is that small clinics in remote areas are very poorly deserved by the suppliers. Usually suppliers will focus on very dense areas and they will charge a higher fee to clinics that are remotely located. So we have different solutions. One, our solution, and which is very innovative, is a B2B marketplace that is very similar to Amazon. So basically any clinic, especially in remote areas, can purchase medical supplies online and get delivered within 24 hours. So to achieve that, we have basically onboarded thousands of suppliers and manufacturers that have listed their products online, and that we then will supply to the hospitals and clinics. So we have more than 42 fulfillment centers across India, and now we are starting to expand also internationally in the UAE, in Kenya, in Saudi Arabia, and in Egypt very soon.
With a click of a button, hospitals and clinics can access a world of medical supplies at the right prices and precisely when needed, thanks to the transformative power of technology.
We see Kenya as like an entry for us into East Africa, as a hub as well, because of the healthcare market, the healthcare dynamic that is growing here. There are a lot of private stakeholders which are very dynamic, which are growing, investing, innovating. So we hope to be able to very soon partner with healthcare providers to bring more efficiency in the procurement and supply chain, and ultimately also bring innovative products, innovative solutions to the market that will drastically change the dynamics.
It's very important for we as healthcare workers to be here during this conference because we have specialists and people who, investors in health and stakeholders who we can engage with, gain new insights and also collaborate with, both in public and private sector, to be able to enhance our healthcare quality and our delivery in the country. Or we as Kenya, in terms of thinking about our economic development and investments, having people from outside come in and see what we have to offer and the whole East Africa region. There's also a lot we have to offer in the area of healthcare business and also healthcare innovations that we'd want to share with the world and also hear what the world has to share with us. I think as a country we know the journey we've walked with universal health coverage, but with the bills that are now coming in the social health insurance bill and the others, this is an area or a discussion that will be very valuable, even as we see the way through to our universal health coverage as a nation.
We also meet Leila Fan, the sales manager at Jiangsu Yongxin Medical Equipment and Company Limited, who sheds light on how this company is contributing to the healthcare landscapes with cutting-edge equipment.
This kind of trolley are most manual one in your country, and this time we bring hydraulic one to here to make the patient feel more better and the nursing people more easier to use it.
This year, for the very first time, we're introducing something called MedLab, which is a big laboratory brand globally. It's the first time in the region that the IVD and laboratory event has happened. So I think this is a big opportunity for laboratory and IVD products, but also some of the laboratory healthcare professionals, so a lot of pathologists and technologists, haven't ever had a conference in the region. So I think this is the first time for that, so I think that's a big takeaway.
But our journey isn't complete without the stories of those who sees these innovations as ray of hope. Meet Dr. Sseruyange, a dentist from Uganda who journeyed to Nairobi to witness the future of healthcare.
Yeah, I'm Dr. Sseruyange. I'm a director to International Paramedical and Nursing School, Maya, Kampala, Uganda. We came for this medical exhibition. It has been really so nice. We met so many companies, some from Germany, others from India, others from China, others from indigenous Kenyans who are distributors. It has been really nice. So we hope to order so many equipment from them, and there's so many medical training models we use in our nursing schools in Kampala, where we train the nurses from International Paramedical and Nursing School, Maya, Kampala. So it has been really nice. Yeah, I thank the Kenyan government for putting up such a thing.
His eyes sparkle with curiosity as he explores these groundbreaking innovations, envisioning the possibility they hold for improving healthcare back in Uganda.
I looked at the new technology. I'm a practicing dentist. I looked at new technology, and I'm a trainer of medics as an investor in the medical world. And it's really nice because new things are coming on the market. This is so nice because we meet a number of medical distributors and medical manufacturing companies one-to-one, other than using the internet. So we really thank the organizers and other people who are watching. It's really good to come and visit, because you'll get the real touch and the real talk to the manufacturers and the different companies and distributors. So it makes you very easy, like, and confidence when you are making any order.
Medic East Africa is where the present converges with the future, creating a symphony of information.
Medic East Africa now has established itself as not just the largest event in Kenya, it's the largest event in the region. So I think some of the topics that have been presented here over the next 3 days haven't been presented, since COVID-19. But also I think some of the companies that have traveled all around the world, to find new investors. I think there'll be a large takeaway from public and private hospitals that they'll have met with new companies and potential new partners, going forward.
Creating a symphony of innovation. Stay tuned for more stories where innovation meets dedication and transformation takes center stage in the world of healthcare.
Thank you so much.
Thank you. That was really good.
My name is Chemtai Kirui, reporting for CAS TV from the Kenyatta International Conference Center in Nairobi County.